Hello everyone, and welcome to this new lecture that we will be talking about cleft lip and palate. In this lecture, there is a serious disease that is very prevalent, and many people have or has this disease. First of all, let's start with the types of this disease. So what are the types of this disease? I will tell you what are these types, but you have to listen carefully for what I would have to say. Sometimes the cleft is involved with the palate and lip, and sometimes the cleft is only involved with the palate. Sometimes it is a non-syndromatic disease that occurs in isolation, that is only happening to the lip and palate, or just the palate. Sometimes it's syndromatic, that even though it occurs with the palate and the lip, or just the palate, it is accompanied and combined with other physical developmental anomalies, and that's why it's called a syndromic. Next, this type of disease is classified into blocks. As you can see in this picture, there is block 1, 2, 3, 4, 5, 6, 7, 8, and 9. Starting with block 1 and 4, that means it only involves the lips. Then when it goes to 5 and 2, 3 and 6, that means it involves the hard palate to the incisive papilla. This is the incisive papilla, and this is the anterior portion of the hard palate. 7 and 8 here involves the posterior portion of the hard palate, and 9 it involves the soft palate. And again, just to clarify, 1 for lip, 2, 5 alveolus, 3, 6 hard palate anteriorly and incisive ring, then 7 and 8 hard palate posterior, and 9 is the soft palate. There is another classification, it's called views classification. Views or vows classification. And this scientist has classified the cleft lip palates into 4 groups. The first is the cleft when it's restricted to the soft palate, posterior, meaning block number 9. Then group number 2, when the cleft and the clefts involving the hard and soft palate, but limited up to the incisive papilla. This one is the incisive papilla. Again, group 1 is only the soft palate. Group 2 is the soft and hard palate, limited to incisive papilla. Group 3 is complete unilateral clefts of the soft and hard palate. Group 4, complete bilateral of the soft and hard palate and lip, of course, and the alveolar ridge. So this was the views classification. He started from the posterior. He started from number 9, the soft palate. That was group 1. Then group 2, that involved the hard palate to the incisive papilla. Group 3, unilateral, and group 4, bilateral. And the classification about the block was different because it started at the lip 4 and 1, LVS 2 and 5, 3 and 6 is involved with the hard palate, 7 and 8 at the posterior portion of the hard palate does not involve this, and 9 is or was the soft palate. Now, what is the etiology of the disease? I'll be reading to you. Of course, in order to treat this disease, a good a complex long-term treatment must be obtained depending on the severity of the cleft to obtain good facial appearance, good orofacial function during speech, and aesthetic and good hearing. That's what the treatment. But when it comes to the etiology of this disease, there is genetic factors that can play a role in the development of clefts and make a cleft lip more likely. That these factors are included when a family member or a parent or a Caucasian ethnicity or males that are more prevalent. Environmental factors include cigarette drinking, alcohol, drugs, diabetes, infections, and not enough vitamin or folic acid diet. Now let's go to the management. Last, how to manage cleft lips and palates. There is 4 stages. First is fabricating a feeding palate or passive maxillary obturation, stripping of premaxilla or other infant orthopedic procedures, surgical repair of the lip, repair of the palate. And by the way, these 4 stages are in different chronological sequences. At the first stage, it begins with a neonatal child at birth till 2 years. Stage 2, 2 to 6 years. 3, stage 3 is from 7 to 12 years. Then stage 4 is for permanent dentition. As I mentioned before, stage 1, we formulate a feeding plate, and this procedure could have advantages and disadvantages and should be obtained after a complex evaluation of the treatment plan for each individual case. Stage 3, primary dentition, 2 to 6 years. When it is or there is a developing malocclusion, or if it's a severe malocclusion, we'd have to use this second stage to obtain oral hygiene and make sure that in the future we will have a fixed orthodontic procedure or appliance. Next, stage 3 from 7 to 12 years. So first stage was the neonate to 2 years. Then second stage was 2 to 6 years. This one is from 7 to 12 years. From 7 to 12 years, the child is having a mixed dentition between primary and permanent teeth. And the major oral, the major goal of orthodontic treatment at this stage the mixed dentition stage 7 to 12 years is to obtain a correct incisor position. Also to prepare the patient for alveolar bone grafts. During this stage, arch expansion can be undertaken, maxillary protrusion also, and fixed orthodontics can be applied. And to talk more about surgery and bone graft, the timing of surgery depends on the dental development more dependent on the dental development than the chronological age. As we are talking at the chronological age here at the stage 3 of managing cleft, lip, and palate. In order to do a bone graft, ideally the permanent canines roots should be half to 2/3 formed at the time of the bone graft being undertaken. And the bone graft surgery is when the canine that has half to 2/3 of its root completed between 8 to 11 years of age. That's according to stage 3 of treatment and management of cleft lips and palates. Sequencing or secondary bone grafting has been divided into early 2 to 5 years, intermediate 6 to 15 years, and late 16 to adulthood. These called sequences in surgery or sequences in bone grafting. Early, intermediate, medial. 2 to 5, as we mentioned before, neonatal to 2 to 6, 6 to 7 to 12. These times are the important times for bone grafting from 2 to 5 years. Early, intermediate 6 to 15, and adulthood after that, 16 to more aged patients. Last but not least is the stage 4, when the patient has all of his permanent dentition. In this time, a fixed appliance orthodontic treatment is necessary at this time. Fixed appliance. Also grafting, bone grafting, and bone fills the cleft area. And this treatment makes it possible to close the spacing between teeth, which is a major objective of this treatments. This was a very nice lecture, very interesting, very short indeed, and I gave you a brief introduction, a general idea about what's going on with this lecture. Thank you for listening, and goodbye.